everyone. So thank you for joining us tonight. I am excited to have a group of volunteers here, or potential volunteers that want to learn a little bit more about the American Cancer Society Cancer Action Network, and in particular, the work that we're doing around health equity and cancer. So I'm going to share my screen so that you guys can see my PowerPoint. Are you able to see it now? Perfect. Not always. I'm more of a Microsoft Teams person than a Zoom person, so I need a little practice with Zoom, but we can go ahead and get started. So tonight we're going to be talking about your power and your voice advocating for health equity and cancer. So at the American Cancer Society and at the American Cancer Society Cancer Action Network, our vision is to end cancer as we know it for everyone. So making sure that we're working to improve the lives of people with cancer and their families through advocacy, research, patient support, to ensure that everyone has an opportunity to prevent, detect, and survive cancer. So looking at health equity through the cancer lens, we believe that everyone should have a fair and just opportunity to prevent, treat, and survive cancer. Where you live shouldn't determine if you live, but unfortunately, we know that that's not the case. We know that right now, where you live can have a big impact on the types of treatment that you have access to, and whether or not you get quality care. So we're working to change that because we want to make sure that everyone has an equitable opportunity to fight cancer. So when we talk about equity, we're actually not talking about equality. So if you are, and this is a concept that is starting to make it around in the community a little bit more, so hopefully it's not entirely new to everyone. But when we're talking about equality, that's talking about giving the same thing to everyone. So if we think about it as a bike, it's giving the same exact bicycle to everyone. And a bike that works well for me may not work well for my 4-year-old son. He needs a much smaller bike than I do. So if I try to put him on my bike, he's not going anywhere. If my husband tries to ride my bike, he's larger than me, he's not going very far, having a very comfortable ride either. And particularly someone who is, who is in a wheelchair, has other limitations, they're not going to be able to use a traditional bike as well. So you can kind of see in the top, everyone having the same bike, that bike may work well for me, or may work well for one person, but it's not going to work well for everyone. Equity, on the other hand, is giving people the tools that they need that are appropriate for them. So giving my son a kid-sized bike, and he is often riding, giving me that same size bike as the original example, but giving each person a bike that is appropriate for them, giving the person who's in a wheelchair a bike that they can pedal with their hands so that they're able to ride. So hopefully that kind of just sets the groundwork for you. We're talking about equity when we're talking about cancer. We don't want to necessarily give everybody the same tools and resources, because sometimes giving people the same tools and resources isn't what's right for them. So it may help some people more than it helps others, and it may not make it so that everyone has the same access to prevent, treat, and survive cancer. So when we talk about health equity at the American Cancer Society Cancer Action Network, what we do is advocacy and public policy work. So we work with our elected officials to change policy, to change laws, to fight cancer on, a government scale. So specifically when we're talking about access to health equity, we're talking about 3 kind of buckets of work that we do. So around access to care, making sure that people have access to quality, affordable healthcare, and healthcare that actually covers what they need it to. Making sure that we are doing what we can to prevent cancer. A lot of our work here focuses around tobacco control and eliminating disparities in tobacco use. And finally, in accelerating cures. And so this is where we're talking about improving funding for cancer research, but making sure that that research that's being done is being done in an equitable way, making sure that everyone has access to clinical trials. So tonight, I'm just going to share one example of the work that we're doing in this accelerating cures category that we are working to improve access to clinical trials for everyone. So clinical trials are really critical. This is how we find out more about cancer. This is how we find new treatments for cancer, how we find out more about what can help prevent cancer. And they're really an essential step in advancing new treatments. And for a lot of people, clinical trials can be an opportunity to access the latest and greatest in cancer treatment. So not just the treatments that are already available, but what's the next thing that the doctors or researchers are trying to develop. And oftentimes that can be a chance at survival. But due to barriers, we don't have equitable access to clinical trials. So some groups are underrepresented, and these groups can include racial and ethnic groups. Non-white people are less likely to participate in clinical trials. Older adults are less likely to participate in clinical trials. People that live in rural areas that may be farther away from where the clinical trials are taking place, and those with limited incomes are all groups that don't participate in clinical trials as frequently. And as a result, the people that are participating in clinical trials just don't truly represent the diversity of people that are diagnosed with cancer. So you have some groups that are overrepresented in clinical trials and some groups that are underrepresented. So, and due to these barriers, this is quite alarming. 1 out of 5 clinical trials fail because of inadequate enrollment. So this means that the clinical trial isn't able to move forward because there aren't enough people to participate in it. And this can be devastating in a few ways. It impacts the people that would have been participating in the clinical trial and are no longer able to because it doesn't move forward. But it also means that potentially that whatever could have been learned from that clinical trial isn't learned because that clinical trial doesn't move forward. We don't know if that treatment that was going to be tested could have been the next big breakthrough or not, because they aren't able to move forward. So that impacts not only the people that were enrolled in that clinical trial, but potentially also people that are diagnosed with cancer down the line. So we need to do something to fix this. So one of the groups that is most underrepresented in clinical trials are African Americans or Black individuals in the United States. And there are certainly a lot of historical reasons why Black individuals are less likely to participate in clinical trials. But we find that when Black individuals are asked if they would like to participate in a clinical trial, they're equally likely to be willing to participate in a clinical trial. But one of the biggest barriers is that they're just not even being asked. The doctors are not considering them for clinical trials, and they don't have the same opportunities to participate. Another big barrier to clinical trials for all people can be what are called ancillary costs, or non-medical costs that are associated with clinical trials. So these are things like transportation and childcare, and my slide got a little messed up, lodging, and so these are things that are not typically thought of as like the medical cost of participating in a clinical trial. But if you think of someone who lives in Bloomfield, who needs to participate in a clinical trial that's taking place down in New York or up in Boston. And we're fortunate that here in Connecticut, we do have some clinical trials that are happening locally, but oftentimes people need to travel to New York or Boston. And if you're traveling from Bloomfield down to New York, you might need to stay overnight because it's a bit of a trip. And so you're paying for transportation to get down there, whether you're trying to, take the train or you're driving, trying to park in Manhattan, if you have children, figuring out something, someone to take care of your children while you're down the clinical trial, a place to stay. All of those costs can really add up, especially to someone who's on a limited income. And most cancer patients don't have a local clinical trial available. So about 77% of cancer patients don't have a local trial available to them. So we're working on a piece of legislation. So this is the Diversifying Investigations via Equitable Research Studies for Everyone, DIVERSE Act. So basically what this legislation does is it addresses some of those non-medical costs to clinical trials. It allows the clinical trials to cover those costs as part of the clinical trial. So traditionally, when you participate in a clinical trial, the clinical trial will pay for whatever the trial treatment is. So if it's a new drug that they're trying out, they're going to pay for that new drug. Your health insurance is going to pay for any of the standard care that you're receiving that's not additional because of a clinical trial. The clinical trial is paying for all that additional care, but then no one is paying for the non-medical costs. And so this legislation would allow the clinical trial to pay those non-medical costs so that they can help with hotel subsidies or a transportation voucher to help offset some of those costs to individuals to allow them to better participate in trials. It also allows trial sponsors, the people that are putting on the clinical trials, to provide patients with technology to facilitate remote participation. So even though we've been living in the Zoom world for a while now, not everyone has access to a laptop or a device that they can use to do clinical participate in remote visits with their doctor. They can go to a library and access that, but maybe that's not the place that works well for them, if they're in the middle of treatment. So this legislation would allow trial sponsors to provide technology like, a laptop or an iPad. It also, we have so much new technology with, wearables. I have my watch on that tracks my heart rate and all of that. This would allow clinical trials to provide that type of technology as well, if it, helps in the trial. The last thing it does is it requires the last thing the legislation does, so it requires the Department of Health and Human Services to issue guidance on how to conduct decentralized clinical trials. And that sounds super fancy, but think about it this way. We've learned a lot about doing things remotely in the last couple of years. We're doing this on Zoom because we've learned so much about how to do things in a remote world. And this would allow for clinical trials to do more things remotely. So think about that, going back to that example of someone from Bloomfield participating in a clinical trial in New York. Well, what if they could participate in a trial that was based out of New York, but they didn't have to go down to New York for everything? They need to get their blood work done. Do they need to go down to New York to get their blood work done? Or is there perhaps somewhere local that they could go to get their blood work, get their blood drawn, get that, done locally, rather than having to do everything in New York? And so that's what like a decentralized clinical trial is. It's a clinical trial that's still based out of the origin site where the doctors running the clinical trial are, but allows for some or all of the participation to be done remotely. So either through participating hospitals or through using like a local lab to collect blood work or do scans, those sorts of things that can be done in a patient's own community rather than having to travel all the way to the trial site. And that can make a major difference to someone who is having to have blood work done weekly or even more frequently, to not have to travel all the way just for that and still be able to participate in the clinical trial. So this legislation would help issue guidance or like suggestions to people that are putting on clinical trials on how to effectively run their trials in a decentralized way. So I'm going to pause here for a minute and just see if anyone has questions. Feel free to come off mute and ask anything.
I actually have a comment. I know somebody whose sister has cancer, and because she was tier 1 for the state of Connecticut, she has it now where Sloan Memorial is involved in her care and not just Hartford Hospital.
Mm-hmm.
She's able to get a lot of stuff that she wouldn't have gotten if she didn't have that really good insurance. So I'm assuming that the type of insurance you have also plays a big difference.
Yeah, the type of insurance that you have can play a big difference. Right now, all insurance covers clinical trials and the like associated cost, the medical costs involved in clinical trials. So there isn't when we're talking about clinical trials, there isn't a major difference. Even Medicaid covers, that's some legislation we worked on a couple of years ago was a policy to make it so that Medicaid now covers the related costs when you're participating in a clinical trial. But the type of insurance you have definitely and in many other ways affects what's covered and what you have access to.
Mm.
Any other questions or comments? Or did that answer your question?
It did. It's unfortunate though.
All right. So Feel free to jump in at any time if you guys have any questions, but I'm going to go into a little bit of kind of what your role is in this and how our volunteers advocate for these types of policies. And so this is just one example of a piece of legislation that we're working on, but we work on a lot of different things to address health equity. And I think that there's not really a limit to, we get this legislation passed, we're going to be moving on to the next thing, because, like Mara, brought up, the type of insurance that you have very much affects the care you have. One of the pieces of legislation that we're going to be working on in Connecticut this year is to make sure that all people, all insurance has to cover a particular type of testing for cancer patients that is increasingly becoming necessary to get access to the right type of treatment. But unfortunately, a lot of health insurance companies aren't covering it right now. So we're going to work on legislation to make coverage of what we call biomarker testing required by more insurance plans. So there's a whole plethora of things that we're going to be working on. But for tonight, I just wanted to, focus in on the Diverse Trials Act. But what I'm going to talk about now, how you can help, this is the type of work that our volunteers do on all of our issues. So in order to get this diverse trials legislation passed, but also to support all of our other policies. And this is the type of work that our volunteers do throughout the year. So how you can help. One of the leading things that our volunteers do is share personal stories. So this is volunteer Gerardo. This is him down in Washington, D.C. A few weeks ago, talking with a staff person for a lawmaker, sharing his personal story. So his parents immigrated from Guatemala, and so he was born in the United States, but immigrant parents, and his parents, like many immigrants, were working, both working jobs, trying to make ends meet. His mom was working during the day. His dad was working the overnight shift so that they could, take care of the kids. And when Gerardo was, I think, 12 years old, his older sister was diagnosed with cancer. She was about 16. And the impact that had on their family was incredible. His mom had to stop working so that she could get his sister to treatment and could take care of her. And fortunately, she survived and the family's doing well. But their family's story about how a cancer diagnosis really impacted their family and how hard it was for their family to then go from living off of 2 incomes to working, living off of 1 income, mom having to support his sister. Sharing that story with lawmakers really helped illustrate why we need to do more to fight cancer. And so, not everyone has the same exact story as Gerardo, but having individual volunteers, and, he is a freshman in college, had never met with a lawmaker before, and, came in and just shared his story, because as a staff person for the American Cancer Society, I can share all of the statistics and the numbers and all of that, and I can share our volunteer stories, but there's something about hearing it directly from the volunteer that has a really strong impact, and it tugs at your heartstring, and it just stays with you. So seeing him sit down, across the table from a U.S. senator and share his story was incredibly impactful. And I know that senator is going to remember, that he had talked to this young man and is going to work to support legislation to help because of it. So personal stories, that's one of the things that our volunteers do. And your story may not be Gerardo's, but every story is important to us, whether it's, you know, having an impact, cancer's had an impact on your family like Gerardo's, or maybe it's you've lost a loved one to cancer. Perhaps it's, I shared that we work a lot on tobacco work. So maybe it's not even a cancer story, maybe it's just a tobacco story. If I was addicted to tobacco products, I was addicted to cigarettes, and I know how hard it is to quit. I don't want other people to become addicted. There's a lot of different stories that can be really impactful to our work. I think, unfortunately, just about everyone has some sort of story about how cancer has impacted their life, because it just touches so many people. So another thing that our volunteers do is they write letters to lawmakers, good old-fashioned letters. We also will send email messages and make phone calls, but communicating with lawmakers about legislation that's important. So something like the Diverse Trials Act that I was talking about tonight, most lawmakers, they hear about it, they're going to be supportive of it because it just makes sense and it is good policy. But unfortunately, there's just so much going on down in Washington or even in Hartford at the state capitol that lawmakers don't always know about the details about every single piece of legislation. There can be hundreds or even thousands of different pieces of legislation moving at a particular time. And so it can be challenging for the lawmakers to know about it. And so when they hear from individuals in their community, it helps them kind of, flag it and realize, oh, this is something important. It also, makes it a bigger priority. They're all juggling a lot of different really important, impactful things, but the more they hear about a particular issue, the more that they're going to move it kind of up their priority list. So another thing that our volunteers do is participate in what I kind of called community events. So this was back in June. We were at the West Hartford Pride event. We go to different community events. We speak at library events. we go to community events. Oftentimes we have our volunteers. So this is Mara probably recognizes her. This is Linda Alderman, our state lead ambassador, who is one of our top volunteers in the state. She was with me at this event, and we were just talking to individuals about the work that we do, asking people to get involved, and we had a petition for people to sign to take action right then. So we're always looking for opportunities to be out in the community, but we're also looking for volunteers to go to these types of events and represent us. And this is something that, like, when we ask our volunteers to do this, it's on a as you're able to basis. It's not an expectation that every volunteer is at every single event, because people have lives and they're busy and your schedule may not align with every single thing. But we ask that, as you're available and as you're willing, we'd love to have volunteers to show up to these types of events to support us. Petitions. So these are old school paper petitions. We still do these at some events, but we also are moving into the digital world and collecting a lot of virtual online petitions as well. But it has an incredible impact when we ask people to sign a petition and then we deliver a massive stack like this and go plunk and set it back on a lawmaker's desk and go, look, all of these people are people that are, live in your district that care about cancer or care about getting the Diverse Trials Act passed. In the case of this picture, this was supporting funding for cancer research and a big increase to funding at the National Cancer Institute. And so we had lots and lots of folks that wanted increased funding for cancer research. And when we delivered these to lawmakers, it showed the lawmakers, look, this many people in our community care about this. And, so when they're looking at the budget and trying to go through budget negotiations and figure out how many dollars they spend in here and how many here, and working with a lot of competing priorities, they know that this many people care about this particular issue. So we ask our volunteers to do kind of two things to support petitions. One is to sign the petitions themselves. So like I said, a lot of them are online now. So we'll send you an email, say take action, sign the petition. And then the other thing we ask you to do is to help us get other people to sign the petition. So share it with your friends and family, send them a text message or an email, or if you're in person with them, have it on your phone and ask them to sign it, or go to different events with us, like that, in the last example, the community event where we were at the West Hartford Pride. That's an opportunity where we're looking for volunteers to come and help out and collect petitions from people that want to support us. So media, this is another way that we're able to advocate for our policies is through the media. So this is one of our volunteers a couple of years ago being interviewed by WFSB, where she was interviewed talking about her experience as a cancer survivor. Again, going back to the stories and how critical stories are, sharing her story in another avenue. Earlier this year, we had a volunteer, a high school student, who wrote a letter to the editor, and we were working on some legislation around tobacco and reducing tobacco use, and particularly vaping. And so as a high school student, she sees a lot of vaping in her high school amongst her peers and her friends. And so she wrote a letter to the editor that she submitted to her local newspaper and talked about her experience at her high school, and really just sharing her perspective, her story about it. That individual letter was ran by her newspaper, but was also picked up by newspapers literally across the country, and had a big impact in helping us get that legislation passed. Because I will tell you that oftentimes, not everyone reads the newspaper, and particularly the letters to the editor section of the newspaper, but lawmakers read that section. They want to know what their constituents are thinking, and so they're paying attention to that section of the newspaper, or they have their staff paying attention to that section of the newspaper. So it's a good way to kind of get the attention of the public, but also get the attention of lawmakers kind of in an indirect route. And so we work with our volunteers to work through the media with letters to the editor, TV interviews. Don't worry, if you're brand new, we're not going to throw you in front of a TV camera right away. And things like the letters to the editor, we work with you. So I helped that high school student with drafting that, and offered her some suggestions of edits and stuff like that. So we're not going to just, throw you out there and expect you to be able to do it on day one. But it can really have a big impact and help us spread the word beyond, our immediate community, and it can really also make an impact on lawmakers. And then, of course, we meet with lawmakers. It's one of the big things we do. This picture was pre-COVID, but this was a few years ago. We had a day at the Capitol where we had volunteers go to Hartford to meet with lawmakers and advocate for, at that time, it was legislation to make it so that you had to be 21 to purchase tobacco and vaping products in the state of Connecticut. And at the time, the age to purchase tobacco products had been 18. And the challenge was that a lot of 18-year-old high school seniors were buying tobacco products, particularly Juul at the time was really popular, and then carrying, selling, whatever to their underage classmates. And so by increasing the sales age to 21, so that you have to be 21 to buy the products, it meant that fewer people, young people that are in high schools, had access to these products. And so when we were working on that legislation and trying to get it passed, this senator on the right was not too convinced about it. He was a little apprehensive about the legislation. He had some concerns, and this volunteer, this young woman in the middle, she was a high school student at the time, and she came in and we had met with this lawmaker before. Her dad had met with this lawmaker before, and he had dismissed us. And then this young girl came in and said, look, this is what I'm experiencing in my high school. This is what's happening. I'm seeing my friends become addicted. They can't get through a school day without using their Juul. And this is a really big problem, and I need you to do something about it. And hearing from a young person in his community really helped change his mind. And oftentimes it's the volunteers, it's the advocates that can have a really big impact on lawmakers. And it's not just young people. It's not just this young volunteer, but volunteers in general. When I go in and meet with lawmakers, I'm a lobbyist. And so they look at me with this, oh, it's my job to advocate for this. And I mean, granted, I work for an organization that I think is doing a lot of good, and I think most people agree with me. I'm still looked at as a lobbyist. But when someone is taking time out of their day, they're taking off of work or taking time away from their family or whatever they are normally doing to meet with a lawmaker and share why this matters to them, the lawmakers really do pay attention, because it's something that you're doing as a volunteer, not just as a paid person. So if all of that sounds great to you, I'd love for you to sign up and join us. So if you are tech savvy, hopefully you are, you can pull out your phone right now and just scan this code, and it'll take you to a sign up form. That sign up form, what that will do is it will get you into our email system. So you'll start getting emails from us about opportunities to take action. I'm also going to follow up with everyone that signs up here to talk to you about how you can get a little bit more involved in doing some of the other things, like volunteering with us at events and things like that, and talk through the opportunities for you to get involved. So signing up isn't a full commitment. It is a, hey, I'm interested, talk to me more about this. I'd like to get involved, and let's talk through how I'd like to get involved. So I'd love for anyone that's interested to join us, to sign up. If you are not a tech person and can't do the QR code, you can also email me. My email address is Natalie, NATALIE.Shurtleff, SHURTLEFF @cancer.org. And so that's another way for you to say, yes, I'm interested. I want to get involved. And getting involved, volunteering with us doesn't have to be a huge time commitment. Many of our volunteers volunteer an hour or two each month. And a lot of the things that we do are pretty flexible in the timing. So if it's sending a message to a lawmaker or writing a letter to the editor, something like that, it doesn't necessarily need to be done at a certain day and time. It's on your own schedule. So sending that message to the lawmaker, if you want to send the message at 9 o'clock at night, because that's when you're free after the kids are in bed, that's okay. If it's easier for you to do it in the morning, whenever, works into your schedule, it's flexible like that. So we have some volunteers that'll kind of block off a chunk of time, like once a month, to do some work. Other volunteers that kind of do it throughout the month. So I'd love to have you get involved and support us. Any questions?
Yes, I do have a question. I'm very interested, particularly with the genomic testing. And I've even been in the middle with insurance companies and my providers with, at the time it was 3D mammogram. So my question is, I'm not sure if it's maybe off topic, but it's, just being frustrated on when do insurances start to adopt the latest practices, the latest best practices? Is this something that's not done until there is public outcry by organizations and by the public and by lawmakers? Is it something until they wait till CMS to adopt, then they'll start covering? It's just, when do they start covering the best practices that come out that providers do want to provide for their patients?
Yeah, I mean, it can be a mix, and it kind of depends on the exact, what we're talking about, treatment or procedure or test or screening. Oftentimes it takes legislation and advocacy to change policy. And so some insurance companies will do it out of the goodness of their heart. And sometimes, that's how things, new drug comes out, a insurance company will say, that looks like it's a good effective treatment, we're going to start covering it. But sometimes it does take legislation to get insurance companies to cover treatments or to cover testing. And so that's, where organizations like ACS can come in. There's also, a lot of other organizations that are doing similar work. We work in coalition oftentimes with other organizations that are advocating for my cat making an appearance, for policies. And so, yeah, it can be kind of a mix. There are, for screenings in particular, the Affordable Care Act requires certain screenings to be covered by insurance plans, but what screenings are covered are decided by a group that looks at kind of what's most effective and takes into account all of the science and data and all of that, and then makes recommendations for what screenings people should get. And then if it has been given a top recommendation from that organization, then insurance companies are required to cover it. So it can be a complicated landscape depending on like what exactly we're talking about. But if there's ever something that like you're wondering like, hey, why isn't this covered? Getting involved with an advocacy organization can be a good place to start, because we often we'll take up issues like that and work on legislation to fix it. Hopefully that answered your question.
Yes, thank you.
Any other questions?
Natalie, I was wondering, because I assume this is all over the country. Are there some states that are hard, like have more issues with this than others? And how does Connecticut rank?
Yeah, so we're a national organization, so we work kind of we have staff working in every state house across the country, as well as at the federal level. And yeah, there are some states that are easier than others. We're really fortunate in Connecticut that we go in to meet with our federal delegation, our federal lawmakers, and for the most part, it's like letting them know about legislation and then they're on board. They're really super supportive of the work that we do. That's not to say that we don't ever have challenges and that we don't have to advocate to make sure that we get things done. There are definitely fights that we have in Connecticut as well, but in other parts of the country, it can be a challenge. One of the big things that we're working on from an access to care standpoint is expanding Medicaid and making sure that people that are in what's called the coverage gap have access to Medicaid. So under the Affordable Care Act, individual states are allowed to provide Medicaid to lower income individuals that are above. There's like this gap of people that are make more money than the traditional Medicaid population, but still don't make enough money to afford private insurance. And so states like Connecticut, right away, we increased Medicaid so that it covers the people in that gap. There are other states that have been very hesitant to increase access to Medicaid. And so we've been working really hard in those states to what we call close the gap and make sure that more people have access to Medicaid, because it can be such a critical ability for people to access the healthcare that they need. If you can't afford private insurance, to be able to get onto Medicaid can literally be life-saving. And so we've been working state by state in the non-expansion states to increase that. And so that's one place where Connecticut, we were right out in front getting it done easily. Wasn't a big fight, but we're fighting hard in some other states to make it still happen.
Thank you. That's good to know.
Yeah, and the work that we do in Connecticut, I think sometimes supports the work in those other states. So
Right.
sometimes we can be in Connecticut can be like trendsetters. So we were among the first states in the country to pass legislation to restrict smoking indoors. So if you remember back to the day when you'd go to a restaurant and you'd ask to sit in the non-smoking section, and there'd be a little like curtain separating that didn't actually keep the smoke out. So Connecticut was one of the first states, not the first, but among the first to pass legislation to restrict smoking indoors. And we're still working in other states to get it done, but getting it done in Connecticut and several of the other Northeast states helped kind of set a trend that more and more states started doing it. So the work that we do in Connecticut, we can be trendsetters in a good way. I'm going to switch my slide now. This is another QR code. So I'm going to continue. Feel free to ask questions if you want. This is another opportunity to take action specific to the Diverse Trials Act. So this is if you would like to send a message to your lawmakers to ask them to support the Diverse Trials Act. And what's really cool about our system is that you will scan the QR code, it takes you to a page, if you already filled out the sign up form, probably remember some of your information that you already inputted. Input the rest of your information because lawmakers request a few more things. And then it will figure out who it's going to send it to for you based on where you live. So the address that you input, you don't have to know, wait, who's my congressman? The system will figure it out for you based off of your address. So most of you living in Bloomfield are probably going to go to Congressman Larson, as well as Senators Blumenthal and Senator Murphy. But any of you don't live in Bloomfield and live in a different congressional district, it'll figure that out for you and it will send it to the appropriate lawmakers. So this is just an example of the type of actions that we ask our volunteers to take and then ask them to then share with their friends and their family to get more people to take action. And it can really be impactful when lawmakers are hearing from lots and lots of people. And lawmakers know that these forms exist. They know how easy it is to send a message this way. So if they only get like one or two, they're like, a couple people care about this. But if they hear from a whole lot of people and they start rolling in, they really go, okay, this is something that a lot of people are paying attention to, and this is something that I need to make a priority. So any other questions for tonight?
I'll tell you that I just did both things and it's very easy.
Awesome.
And I'm glad everybody was able to come tonight because this is a really important topic. And I'm glad that we'll be able to put it on our YouTube station too, so that if you have friends that you think would benefit from hearing this, please tell them it should be on by early next week. But Natalie, thank you.
Thank you so much.
I think Marie, do you have a question? I'm sorry.
I was going to say, I wish I would have known about this before. I'm glad I know about it now, but I wish I would have known about you guys before. You could have probably expedited a couple of things with my experiences, but hopefully that'll change.
Yeah, and we'd love to have you involved now and continue to help us spread the word. I feel like sometimes we are like the best kept secret. Like we try to spread the word, but we are a grassroots organization and we spread the word through word of mouth mostly. I think tonight is a perfect example of that. So we have a volunteer, Linda, who's been volunteering with us for a few years. Linda is Mara's neighbor and was talking with Mara about it. And then Mara was like, oh, I work for the Bloomfield Library.
Right.
We have events like this. Natalie, would you be interested in talking to some of our people? And so that's what made this happen. And I think that, that's an example of, you don't know who's in your circle, and just, share. If this is something that you care about, share it with other people, because you might find someone else that wants to get involved or someone else that has, a platform that we can use to share it with other people. So the more people we get involved, really, the better. And there's no expectation that everyone, be able to volunteer for hours on end every day to get involved. Really, taking an action as simple as this, that, send a message to your lawmaker, can have a big impact for us in getting this work done. And so the more that you're able to do that and share it with other people, really the better. So thanks for joining us tonight, finding out a little bit about us, and help us keep spreading the word so that more people can find out about us. Thank you.
Thank you so much, Natalie. Thank you to everybody who took the time out to come. And I'm going to end it because we're on video, because it's been recorded. But thank you and have a good night. Take care.
Thank you.